All right, fess up on this one. How often have you maybe had a headache for a few hours and you decide to look it up on the internet and finally, 2 minutes later you're getting your final affairs in order, or you're thinking about the bucket list, things you'll never accomplish because according to the internet, it could be very, very serious. Well, that's what's wrong with that. It might be wrong. Dr. David Soria, our medical expert's joining us to tell us why there are complications with looking things up online. I've done that a couple of times and you get so afraid. You want to rush to the emergency room.
Well, sure. I mean, you're not alone. Over 80% of us, when we have a symptom, we do look it up before we call our doctor, before we go anywhere. And it's okay, all right? It's okay to be educated. You want to certainly know a little bit and certainly have some questions to ask once you speak to your doctor. But one thing I don't want you to do is be biased, because they looked at this. And the reality is that if you're looking up your symptoms, the chance of you nailing your diagnosis is very, very small. So then two things are going to happen, right, Rox? You're either going to overdiagnose or you're going to underdiagnose. And if you underdiagnose, there's some serious complications that can occur, right?
That's something we don't think of because we normally go to the extreme end, like, oh my goodness, it's going to be fatal, when in fact you might go to the least benign thing and you ignore something that's very serious.
Actually, that's more common, the fact that people will minimalize. They don't want to feel or believe that something's wrong. And the perfect example is that patient that had chest pain or heartburn that comes in cardiac arrest with Maalox or an antacid around his or her lips because they wanted to chalk it up to heartburn, when in reality it was their heart or having a heart attack. So the least of your concerns is that you're going to delay the diagnosis. Worst is you can have complications of the disease or even risk death.
At what point, I mean, the internet's okay, so after a couple of hours of something persisting, or when do you go to the doctor and say, I really do need to check this out?
Well, I think common sense and good judgment always comes into play. Most of us know when it's something simple, a scrape, a cut, a common cold, versus something that could be more serious. Chest pain, abdominal pain, numbness, tingling in your arm, something like that. Obviously, you don't want to try and self-diagnose, and the internet is not going to help you. If anything, it's going to cause you to delay getting the help that you need. So please don't do that.
Set you back. That's the final word. Thank you, Dr.
You're
Soria.
welcome.
Good to see you.